going to talk about the workforce today. Look at that picture, man. That's the best picture I could find of you, Tom, by the way. Bottom line, I called him last week. I said he had just come back from vacation. I don't even think he was in the office, and said, you know what? We're going to talk about the workforce for the next couple of weeks. I'd love to have you on May 2nd, even just squeeze out 15 minutes to talk about some of the successes you've had in New Jersey, because they have a different approach than we do here, working with the sort of Cross Human Services Coalition. And I'd love to hear about it. And then, so he graciously said yes. And he's been on with us before. He's CEO of the Arc of New Jersey, and he's been a colleague of mine for decades. And he's been, I think, at the state level longer than me, even if it was as associate executive director, because I came on in the fall of '91, and I think, Tom, you were already at the Arc of New Jersey. So, share. Oh, sorry. Okay, they just told me my share screen. That's because I probably didn't share. There's his picture. Thank you. All right. I got to get a better picture. You know, you're going to be on again at some point in time, so I got to get another picture of you that, you know. But I'd probably use this at least twice, you know. And this is really the coalition, right?
It is.
That has had the success. So it's probably apropos, right, that I'm using the picture.
Definitely. Yeah.
And so, you know, in this state, what we've done has been part of a broader coalition. And actually, the ARC hasn't been on the lead on this for years. Decades ago, we were the lead on the salary reserve, and it was called the Access and Quality Campaign and Do the Right Thing campaigns. I can't even remember all the names we've had over the decades, but clearly passing Chapter 257 is a great thing, but unfortunately, it hasn't really moved the needle the way we would have hoped for our workforce. And really, Tom, it's an opportunity with you. I'm going to stop sharing and have you share. And then after Tom's got to leave us, I'm going to go ahead and share the news, sort of where we're at with the workforce with you all. So tell me a little bit. You know, I mentioned the three characteristics you have of your campaign. And first, tell people how successful you've been over the past, is it 4 years?
Yeah, it's been 4 years. So actually, we've had a great deal of success in the last 4 years. We were able to raise the starting salaries of our DSPs by $4.75 an hour. We've sort of been getting that up about $1.25 an hour each year, with an appropriation of about $42 million. But just to go back a little bit, you know, we're all struggling with workforce, and 4 or 5 years ago, we were struggling with workforce. So one of the things I love to do in Jersey is pull together coalitions. So I pulled together this coalition called the New Jersey Coalition for DSP Living Wage, brought all the players in the DD world together, and we really put a focus on increasing those DSP wages. We were fortunate to have great success with our previous Senate president, who had a daughter with intellectual and developmental disabilities, and he really supported what we did. But in New Jersey, and I'm not sure what's going on in Massachusetts, there was a law passed that minimum wage is going to increase to $15 an hour.
Yes.
We had to make a point that these are not minimum wage jobs. Matter of fact, being a DSP is far more important and more difficult than being a minimum wage job. So we targeted out that at minimum, these jobs had to be 25% above minimum wage. Through the coalition, we branded that. We branded how important DSPs were. And to the point now where our governor knows that as minimum wage goes up, and it goes up $1 a year every year until it hits $15. So we're at $13 an hour, goes up to $14 an hour January 1, 2023, $15 an hour 2024. We actually branded this. We worked really hard. We were all over the place. Now the governor automatically puts the $1.25 an hour increase for our DSPs as minimum wage goes up. But we also saw this compression issue as a problem.
I was wondering, you already anticipated one of my questions.
So we were able to really educate our Department of Human Services and the governor's office that it's not good enough just to put that $1.25 an hour in for our DSPs. We would have a compression issue. So for the last
for folks that are listening that are family members and self-advocates, compressions when your frontline supervisor or your clinicians, right, their salaries become closer together. So people, why am I going to be a supervisor, right? If I'm making the same as my supervisee, okay.
So we were able to include that in our advocacy and in our discussion. And each year for the last 3 years, we've been getting funding to increase those salaries also, so that group home managers, all those positions that Leo, you just mentioned, are now included in this DSP wage increase. And now, the compression issue also. So the money goes out every January, our rates get increased, and providers have to show to the department that they passed on that rate increase to the DSP. So there's accountability in all the work that we've done. And, we're very, very excited the way this has gone. Right now in New Jersey, well, according to recent data, well, the last data we collected was 1606 was the average starting salary in New Jersey, but that data is about 18 months old. I would expect now it's probably above $17 an hour, which really doesn't make us necessarily competitive, but it's certainly better than what it was. And we just have to keep staying ahead of this minimum wage. So as a coalition, we've done a really great job branding this. We're excited where we are, but how quickly did that fall behind with the rate of inflation now, and particularly New Jersey, probably like Massachusetts, expensive state to live in. So while we branded this, we're really excited to stay 25% above. It's really not enough. We are also working on legislation that will provide a cost of living increase annually based on an index, probably CPI or something like that, which, every year fighting this fight, getting the coalition, getting the grassroots, it takes a lot of energy, a lot of work. We're really now pushing for this bill to go forward that will increase the DSP wages and the compression wages every year based on an index. So we're just getting off the ground with our grassroots advocacy to support that legislation.
So you've written the legislation already?
We've got it. It's introduced, so it's already out there. Now it's a question of getting it through committee and, all the steps that this legislation needs to go through.
When does your session end? Are you in the same cycle as us? Does it end early this summer? Or?
Yeah, usually the end of June. Our legislature takes about a 2-month break, and then we're back in from September to June. They're pretty, steady meetings. So,
we have 2-year terms for Senate and House. Okay. So I don't know about your terms. So it ends earlier, and then there's informal in the fall.
2 years, Senate 4 years. Yeah.
Yeah. Okay. So your Senate will keep going, or is it staggered, or is it all at the same time for the Senate?
It's staggered.
Okay. So yeah, some people, interesting. That's a fun thing one day for us to talk about with the group. How does that affect our different states? The way because ours will close early. So next year our session would go to November and end somewhere around there. But it'll be informal from July sometime on, unless they call a formal day.
Right. Yeah, absolutely. And we've had that happen in New Jersey where they've come in over the summer if there's a critical issue.
When did you introduce the bill, Tom?
It was introduced in January.
Okay.
And, so now we have $42 million in the governor's proposed budget, which we're working with the legislature to keep in there. But as part of our advocacy on the budget, we're slipping in. We need the support of this legislation. It's going to be a tough lift, but, we've faced tougher battles before.
Yeah. And also you introduced it this year, so that when the session, does it reopen next January? The session is a brand new session, or is it?
No, it just keeps going for 2 years.
Okay. Yeah. So yours is on a different cycle than ours. Okay. So we're ending our 2-year cycle. So we have a bill in the can. We didn't introduce it yet because we ended up negotiating with the trade in our field for a common bill. But again, you branded yours with a name, right? The DSP, and then you were able to take that brand and generalize it, right?
And we've got everybody on the same page, same sound bites, same, talking the same language. We have great recognition of the issue.
Yeah. So I think, do you see any spillover to other fields from the work you've done?
Oh, absolutely. Matter of fact, our home health aides, CNAs are all getting increases this year. So we sort of led the charge, and we kept it DD specific, right? Because once it goes too large, if you try to include the whole human services field, the number gets too big and it scares people away. So we said our focus is just going to be for individuals with intellectual and developmental disabilities. But this year, everybody saw the success we had. It spilled over. And, quite frankly, in their defense, everybody deserves a rating.
Oh, of course, of course.
So,
Yeah.
So while we didn't champion, there was certainly a spillover of all the work we've done down there. And, the governor put a significant amount of money for workforce for all the human services field, from mental health, CNAs, across the board, nursing homes, all getting a salary increase this year, or proposed in this budget.
And that makes it a lot easier. We have a salary number, a rate number of 230 million, which sounds awesome, but it's 10% actually for this year's rates. We're on biennial with different programs. I don't know if you are. Like if you have day staff, you're all at the same time.
Yep.
Well, you designed your program that way, right? You designed your advocacy, which is smart. You didn't want to have people juggling one wage one year and another wage the next year. We have that problem. So our salary right now, our hourly rate is around $16.79 an hour. But Massachusetts, well, what they're reimbursed, I'm sure people are trying to supplement that. But the problem in Massachusetts, we're like the fourth highest cost of living state. You're probably not far behind.
I think we're probably ahead of you, actually.
Or ahead of us. Okay, so I mean, we have similar populations.
We're all up there
as a state, right? Yeah. The millions we have in the state. So it's us and Indiana. I think the three states. I mean, I'm sure there's others, but I always look at your state and Indiana in terms of comparison. Yeah. And so I think it's a lesson learned about this. I don't know where we have to go in terms of. We'll see what happens with this round. Clearly, the trades made the ask of 580 million, so 350 more million, which we supported 100%. We, in fact, probably ran in with the number right away as soon as we got it from our colleagues, because we already had meetings scheduled with Ways and Means. And the first phase, we came out with 0 on top of the governor's. So we're facing that reality. To be fair, in our advocacy, we had, even though we made this a priority, we also had significant increase for DDS, because what they had done, right, when you don't spend the money during, I don't know if you experienced this, that the governor's budget started out lower than it should have, okay, at like 60% capacity for day. And so we said we needed at least 85% to get the ball rolling. So we actually got over 70 million just for DDS line items, 51 million in day unemployment, not shabby, but
that's great.
What that did was, I wonder, right, if people, they can say to the rank and file, look, they're okay, we took care of these priorities. So I think it's a real balancing act. But if you can't hire people, you can't deliver the service, right?
There's no question about it. Matter of fact, many of our day programs are only at 70% capacity. Not that folks don't want to come back, we just can't get the staff to fill it. So I've been with the ARC in New Jersey for 37 years. This is the worst staffing crisis I have seen. We have to stay at it. But we're doing a lot of things. So I always said, look, we need the wage increase to get people through the front door, but then we need other strategies to keep them there. So now we're partnering with our community colleges, doing DSP certifications. We're doing everything we can with New Jersey Business and Industry to get people into our field, right? So we want people to be able to make this a career, and we're looking at strategies to do that. It's, wage is important, right? Because we have to get them to the front door. Once we get them, we have to develop strategies to keep them. And we're in the process of doing that now.
So you're building for the chapters or across this field, or
across the IDD field.
Okay. Yeah, I'll have to check in with you on that down the road. I know Iowa, one of our colleague from Iowa, who I really didn't know well, did a nice presentation about something they developed there with the community colleges.
We're right in the middle of that campaign right now. So a bill was passed. We got $1 million from the legislature and the governor to promote these jobs through the community college system.
Well, you know what I just learned on just the TV this morning as I ate my eggs, that community college enrollment is down 13%.
Yeah.
So what good timing for you to be doing that? Maybe we should be doing it too.
Well, we're hopeful. We have to try everything we can. This is not crisis is not going away overnight. We really have to look at short term. We need the money for the salaries, but we also have to consider our long-term options. and we're doing both now in New Jersey.
That's great. All right. I don't know if anyone's got a quick question for Tom. I'm going to let him go because he's got a really busy day. He had a wonderful vacation. I'm so glad to hear it was his first
Yeah,
since the COVID
2.5
crisis
years.
happened.
Yeah, it's great.
You know, I feel guilty because I went away for a week last summer, you know, so nearby though. You took a flight, I think.
Yes.
But you went south when it's worth going south. I'm convincing my wife that going south in August is not the thing to do.
Yeah.
You want to go north.
You know, Leo, I love working with you. I love collaborating. I wish all of my friends in Massachusetts good luck in all your campaigns. Your advocacy is incredible. I learned so much from Leo in the Arc of Massachusetts. So everybody up there, you're doing a great job. And thanks for all you do for people with intellectual and developmental disabilities. Glad I could spend a few moments with you.
Yeah, really glad. Tom, thank you. And thank you. You're great. Really a pleasure to have you. Take care.
Have a great day.
Bye-bye. So that was a pleasure to have him with us. You can see why I like Tom. Well, I like to have him join us. And the similarity with the states. Let me just show you the fact sheet now, and then we can just have a dialogue about this. You see, there's many ways to reach a goal, you know, and we've tried to be good team players here with what we have in Massachusetts to deal with, right, and respectful and all that. So let me share the screen again and show you our new fact sheet, which. Okay, great. Well, it's clearly not there. Hold on. Let me unshare for a second and touch it so it'll be ready to pop up for you. But this is basically a revised request. And the revised request is for the Senate because, you know, the House did provide over 70 million, right, as I shared last week, for our services and programs. So, which is nothing to complain about. It's actually something to rejoice about. And much appreciated. So let me pull this open, send request and chart. Thought I had pulled it open, but here we go. Coming up here, there we go. Can you see it okay? So what's different about this chart is right in the very beginning, smack dab for all of you, is to see this request, which is a lot of money, as Tom implied. When you go across human services, you know, he's talking 44 million. His world is probably similar to our world in terms of scope and breadth. And of course, he's not talking about Medicaid dollars. I'm not really even sure. I'll have to talk to him sometime about how Medicaid, you know, how we have a big rehabilitation program in Medicaid, right? That's not included in this chapter 257. So for those of you that have loved ones or brothers or sisters or friends, or you yourself or a person with disability and rehabilitation, this chapter 257 doesn't address that, which is why we have another request, which I'll touch on in a minute. But this is a line item in administration and finance that becomes a reserve for setting rates. And just so everybody is really clear, when the rate is set, there's a form, there's a document that the states shows why they picked 230 million. The administration says we picked 230 million. It's based on direct support salaries being $16.79 an hour, $16. That's literally in the sheet that sets the rate. So for people who say, like, we'll hear, you know, unfortunately, other groups that I won't even talk about, the other groups that are really, it can be destructive, that claim providers just don't want to pay the money. This is the reality. The reality is the rate is set based on what the benchmark that the Health and Human Services Secretariat sets for different programs. So it's $16.79 an hour. And this, again, remember, this is just for DDS or DMH or state agencies, not Mass Health. And so basically the goal, the rate right now, I'm pretty sure would only keep things stable of that extra dollar that was given through ARPA, which was the American Rescue Plan. Remember that big infusion of $400 million across the system in Mass Health and DMH and DDS? That's to keep that salary level in that ballpark. So, and that salary level has already been established for day programs. It's like CBDS, community-based day supports, that basic level is already established. Now, when they set the direct service rates, they also set the frontline supervisor rate, okay? But I just want to again remind you that a DSP or a direct worker rate, that those staff, and it's you know, basically could be working for a year or 4 years. It's a blended rate. It's got nothing to do with longevity. So then we ask that the Senate protects and keeps the increases made in the House budget, which were significant, over $70 million. And then you have, maybe I need to make this bigger, the view on this. Let me zoom it up a little bit. Oh, it's not letting me. Let me make it higher this way. There we go. Okay. So we're asking them to maintain those line items. And Mass Health is an entitlement. So a lot of times on our fact sheet, you won't see us put a number for our goal because A, it's very complicated. Our programs are bunched in with a lot of other programs, but also it's an entitlement. So if they agree to do something, the dollars will go up to reflect what they agree to do, the House and the Senate. But this is the piece here that I'm talking about. For Mass Health, at this point, and hopefully that will change soon, we're asking at least to maintain the rate increases that allowed the staff salaries to go up the 10% that they did. And in day rehabilitation, I don't believe it's close to $16.79 an hour, the benchmark rate. Just so you know, it's lower than that. And anybody who knows the difficulties in rehabilitation knows that they haven't gotten the same rate increases. So we're in a tough situation. In 257, we're in a tougher situation with Mass Health. And people doing adult foster or family care, we believe should continue to get additional support too, which they did not for most of the crisis that we experienced. And then finally, not finally, another important area is to allow flexibilities for families who have people at home. This did not pass the amendment. Rep. Brian Ash filed that amendments for Mass Health and DDS. And so we're going to keep working at that. We're not going to stop with the budget process. And then here are the line items that I was talking about in terms of what we were facing. So this will get out to all of you. We'll combine it with the PDF. But do people have any questions about this? Let me pause and give time for the workforce or other questions people might have about the budget. And I'm not looking at the chat, so I should look at the chat too. But as you can see, here's that. It's the huge ask, and that's Tom was saying how big an ask can be when you look at the whole picture and the challenge of that. So, all right, so that gives you a snapshot of, I mean, if you look at the numbers here in the day in employment, it was a huge lift, and we're hoping to see that day in employment number. It went from 227 million to 278 million. So it was a big lift. And same with transportation, got a nice lift. Family support had started at a nice lift, so it was about 5 and change more than the year before. And then technology got a nice lift in the House of 1.25 million. So there was a lot of positives. Children's waiver for autism and autism omnibus got a nice lift. So literally the House gave every single request except for one. And the one request they didn't give was for another $1 million for DESE. And last year, the funding, people had spent less than 9 million in DESE. So I think they felt like, until you're spending more, we'll skip that one. All right, let me go back to, we're going to basically want to encourage you to engage. The fact sheets are on the web. I'm just going to also share one more minute this. And PowerPoint, of course, I didn't touch it yet, so it's not showing. Let me just hit the PowerPoint again, and let me just get up there and share it. And let me go backwards for a second on the PowerPoint. Just that, basically you can get the fact sheets you need in the Action Center. Tomorrow, there'll be a call-in for the Senate budget. Today, AFAM, Advocacy for Autism, has a call-in. So you can go onto their site, afmaction.org, or you can wait for ours for tomorrow and check out the action up. So ours is an up. Oh, this is the old one. Oh my God, I'll take it off. So I got to make sure the right one's there. That's a riot. Sorry about that, folks. So we'll have to update that. Actually, we'll just take it off and put the new one, the new page there. And then, yeah, let me stop it. Let me stop it right there, the share. We'll make sure we update that before I send it out. So Randy asks, the DDS where do not include. Yes, Randy. So I try to emphasize that in each presentation. We do the bill we have, the bill that ADDP has signed on to that we will file in the new session. So this session ends in July, this legislative session, then there'll be the elections. And then come January, there'll be a brand new session. We will have the bill filed with the new session. And it does cover day habilitation staff, that bill. And it uses the language. What our compromise was, instead of putting a dollar figure, like this particular advocacy would get us to $20 and change, the big ask that we're making. The DDS bill, the DDS Mass Health bill, or the ARC bill, I should say, it's now going to be an ARC, the ARC and ADDP bill, will talk about 75th percentile that the Secretariat has to use to establish rate increases for staff. So they go to the Bureau of Labor Statistics and they would take this percentile, and it applies to both DDS programs and Mass Health day habilitation. We can't really, we didn't get into the PCA and things like that because that requires more stakeholders to agree, but obviously we need it for other services too. But clearly we want to address the day habilitation situation. So what you want to do is make sure, at least at the minimum for this cycle or in the near future, get that ARPA money. Let your senator and representative know that there has to be a rate increase or we're going to have a terrible time at the day habilitation services and an AFC and PCA. I mean, you're welcome to mention that too, because we just didn't feel like, without having all the stakeholders buying in, we felt like we couldn't add that to our fact sheet. Because, obviously PCA is cross disability program. Any other questions? If not, I'm going to let you guys sign off early. And next week, we've got Sonia Stewart. I'm very excited. Kerry had recommended her. Sonia has her thesis on the workforce and specifically on how COVID affected it. So we're looking forward to talk about it. And then Pam said, Tom mentioned accountability to make sure increased wage. Do we have that type of accountability? I mean, we do have that type of accountability. And I really want to emphasize that even people are adding above the 60 and 79 to recruit people. I'm hearing this, not from everybody, because some organizations don't have the money to do that. But, clearly some organizations are actually adding to get to the 17. And remember, your workforce, your direct workforce, your workforce in general is 70% of any contract. Think about it for a second, okay? So the idea that you could take money from occupancy or what you pay your executive director or, whatever, and, that's not realistic, that you're going to magically, with 30% of the money, fix the problem you have with 70% of the money. Plus, you do have to pay for the rent, and you do have to pay for utilities and phones and training and all of that stuff. So, but there was accountabilities with the ARPA funds. I'm sure if this big number ever passed, there would be accountability built into it. I can't imagine there wouldn't be. But in our bill, there is accountability in the bill, if you're asking about the bill. And we did that on purpose. So, and then, obviously legislators welcome to fool around with that and change it, revise it as it wishes. But our main goal is to get it to happen. And Judy Doherty saying, offer health insurance, no waiting period. This is a better draw for some to work than the pay rate. Yeah, interesting. Good. Yeah, an interesting idea. I know I have to tell you what's interesting about that, though. My colleague tells me, one of my colleagues who I've worked with for years and worked with his predecessor for years, he would say the staff that they found recruiting always wanted the rate more, the salary more. That was just his experience. And he's, and they would, the whole issue, what else was it, retirement or things like that. For some reason, you would think that would help, right? As well as health insurance. But, you would think that would be a powerful incentive. And maybe with older workers, it is a powerful incentive. Yeah, 90-day waiting period. Wow. We don't have a 90-day waiting period. I'm going to have to find out. That is ridiculous. Wow. I didn't know some places. I'm going to check with my office. I don't think we have ours. I think ours is 30 days.
90 days at Bridgewell. It's 30 days at HMEA, or it was.
Oh, so it does vary. Okay.
Yeah. And DDS is 60 days. So if you work
Is it really?
state,
Oh
yes.
my God.
So this is a major thing that this has come up recently in realizing it was kind of a big deal in paying for COBRA. You know, if you do the math for somebody, reason agencies may not recruit somebody is that because let's say you're on a standard plan, particularly with a high deductible, it's about $2,400 a month to take a family plan for 2 months. So I can tell you, I only did it by taking all my vacation pay and using it. But this is, I
can't even imagine the 90. Yeah. I never heard. I mean, it's 30 days at our place, and I didn't know there was variability on that. Wow.
So I think this is
you're
a
right. Then you take COBRA with your old business, right? Correct? Is what you had to do when you moved.
102% of your premium. So I think this is a missed opportunity. Not to say that this is, you know, some people, if you're 20, maybe you're looking at this thinking, okay, I'll take this, you know, more money.
Right.
But if you're looking at this and you don't eligible, I think it might be part of the reason why we're not necessarily getting good people to move to other positions. So from other places.
I'm gonna ask the trade organization to do a survey to see, you know, what our agency's doing, because I cannot even fathom that. Okay, quite honestly.
Well, I have brought this up to you know, the CEO there at the time, saying, I think this is before COVID, saying this is a problem because even, you know, I had to think about this twice. And or there were people, even people who come to DDS for NRS houses, this is a big problem, 60 days. So
Right. So, you know, what you just taught me. So here, folks, is here I have 30 years of experience in just this position. I have more experience running an agency that provided services, right? And ran and residential before that. It's clinical. And then I learned something new. I feel like every freaking year, well, a bunch of stuff new every year, but today I'm learning that that's another way agencies decided to survive, I assume, right? Financially.
yes.
But they made it.
And their HR
they're not
department.
doing it to be bad. They're doing it fiscally to make the pay more, probably. They're thinking, they're betting on paying more, I have to assume, and having the metrics work, right, with the 60 days or 30 days in the case, the extra 30 days at the DDS. Yeah. I'm going to ask Ellen.
Exactly that. If they do especially it's an HR decision and they're looking at this and they'll take it to the CFO and say, well, this is, and they have these high deductible plans. So you go into a plan that has a 4,000, 8,000 deductible and a 90-day waiting period. That's kind of a disincentive to someone who might be coming from another area. I see bulletin boards saying, pay the day you start, benefits the day you start from retail. So I just am throwing it out there, not as, I should change my title, not as the DDS person, but as a person who worked a long time in family support. And personally, this is a major, it was enough last year that I was able to itemize my medical for the first time in years. Wow. You know, because if you add the COBRA, the deductible and everything else, it's a major deal. So sorry to
thank you.
To co-opt your call.
No, you didn't. You didn't. What a pleasure. I didn't even know you had moved, by the way. So congratulations. How long ago did you move?
Last June, but I'm still around.
Okay, good. Well, that's great. So you moved a few times. I know you through your different hats. So that's great. Great that you're still hanging in there. We really appreciate everything you do. And I'm trying to see if someone else have their hand raised.
Yes, Lucy does.
Yeah, Lucy. Hey.
Yes. Hi. I have a question. Is DDS currently allowed to supplement the rate of pay of day hab workers?
No, it's just the wrap, Lucy. No, they're not. In fact, that's the problem with PCA for families, right? You have to be very creative. If you're I'm changing chairs here because my knees are killing me. You have to be very creative as a family or a person with a disability if you try to give any variable amount of money to someone. So no, DDS totally does, the wrap is totally a separate issue. It's for additional help at a rehabilitation setting, and the agency pays what they pay the individuals, and it has no relationship with that. But we need to work on the rate setting for Mass Health too. It's as simple as
Yeah, I don't know whether you announced to this group about the change in moving the wrap from DDS to Mass Health.
I did not, but I'm happy to let people, if you haven't heard, October 1st, Mass Health will take over responsibility. DDS, if those of you don't know what a wrap is, if someone needs help eating, someone needs help toileting, or someone needs help because of behavior, certain number of hours a day, there's a one-on-one staffing is allocated if you can make a case for it. And that money then goes to the agency to hire someone one-on-one, which, by the way, hasn't been going too well, because that's part of the reason some people aren't back at their day hat program, is they can't hire the one-to-one staff. Yeah. So that will change. Mass Health will be managing that effective October 1st. So new people will go through what's called Optum, their front-end agency. And right now is a great time, if you do have any concern about needing one-on-one, to do it now while DDS is still working it through. And as Lucy knows, there'll be a 2-year grandfather period. So people will then, 2 years from now, have the hassle of making a case again for that level of staffing to the Optum folks at Mass Health.
Thank
So,
you.
all right. Yep. If anybody else quickly, and we'll, not quickly, it doesn't have to be quick, but I just want to thank everybody for the conversation and great points. Both points that we just brought up were awesome, and the question about accountability as well. So I want to thank everybody for your attendance. And next week, Sonia Stewart's going to talk about her thesis on how the workforce was affected by COVID. I'm looking forward to that. And it helps us understand better what we're facing these days. Take care and have a great week.
Bye-bye.
Bye.